Hi there, I'm Tony Lee, and this is Hot Flasher, your daily menopause podcast that serves up fresh news, research, and wellness tips. I've built a daily news pipeline to find the latest on women's health and menopause research. Allow me to introduce my co-host, Nikki, who handles the headlines. Take it away, Nikki.
Thanks, Tony. We've got some serious myth-busting to cover today. I'm calling this Myth-Busting Monday. Wait, it's Wednesday, because sometimes the best debunking happens when you least expect it. And honestly, some of these myths have been hanging around so long, they deserve to be called out any day of the week. Let's start with something that should make you either laugh or bang your head against the wall. Scientists have finally, and I mean finally, created a detailed 3D map of the nerves in the clitoris. Groundbreaking work, right? Cutting-edge research that's going to revolutionize our understanding of female anatomy? Well, sure, except they mapped the nerves in the penis almost 30 years ago. 30 years ago. This story from The Guardian really captures the absurdity of it all. The researchers can't even see all the nerve branches of the clitoris through regular dissection or clinical imaging, which is exactly why this detailed mapping was so important to do. But, apparently, it took 3 decades to get around to it after they figured out the male equivalent. The Guardian piece mentions that at least men have stopped denying the clitoris exists entirely, which feels like the lowest possible bar for progress. But okay, they also coined the term clitorate, as in, no excuse for being illiterate about the clitoris anymore. I actually appreciate that wordplay. What strikes me about this isn't just the obvious gender bias in medical research. It's how this connects to everything we talk about on this show. When medical science has spent centuries either ignoring or misunderstanding female anatomy, is it any wonder that menopause research lagged behind? That we're still fighting myths about hormone therapy? That women in their 40s and 50s are told their symptoms are just stress or just aging? This clitoris mapping isn't just about sexual health, though that matters plenty. It's about a pattern of medical neglect that affects every stage of our lives. Speaking of myths that refuse to die, let's talk about head lice. NPR just published this fascinating piece about why these little creatures are apparently here to stay, no matter what we throw at them. Now, you might be thinking, Nikki, I'm dealing with hot flashes and brain fog. Why are we talking about head lice? Fair question. But if you've got kids or grandkids, or if you work around children, you've probably encountered the panic that follows a head lice outbreak. And the myths around lice are surprisingly persistent. The big myth? That lice prefer dirty hair. Completely false. Lice actually have an easier time gripping clean hair. Another one? That you need to wash everything in hot water and bag up stuffed animals for weeks. The research shows lice can't survive more than a day or two away from a human scalp. They need our blood to survive. But what really caught my attention in this NPR story is how lice have developed resistance to common pesticide treatments. These tiny insects are evolving faster than our treatments, which explains why traditional lice shampoos often don't work anymore. There's something oddly parallel between this and hormone therapy myths. Both involve treatments that worked differently in the past, leading to outdated advice that persists long after the science has moved on. Both create unnecessary panic and shame, whether it's the stigma around lice or the fear-mongering about hormones. And speaking of hormone therapy myths, we need to talk about something huge that happened recently. The FDA removed the boxed warning from menopausal hormone therapy products in November 2025. This is massive news that somehow didn't get the attention it deserved. For those who don't know, boxed warnings are the FDA's most serious safety alerts. The black bordered warnings you see on medications with significant risks. Hormone therapy has carried this warning since the Women's Health Initiative study results came out in the early 2000s. This new paper in the journal Menopause calls this removal a historic regulatory inflection point in women's health. And they're right, this boxed warning shaped more than 2 decades of clinical practice. It terrified women and doctors alike, leading to massive drops in hormone therapy use, even for women who could have benefited from it. The paper traces how that original boxed warning was applied across all hormone therapy formulations and routes of administration, essentially treating a birth control pill the same as a low-dose estrogen patch. We now know that's like warning people about all cars, because some cars from the 1970s didn't have seatbelts. What frustrates me is how long it took to correct this. How many women suffered through brutal menopause symptoms because they were scared of a treatment that, for many of them, would have been beneficial. How many doctors stopped prescribing hormone therapy not because the science said it was dangerous for their patients, but because a blanket warning made it seem universally risky. The removal of this warning doesn't mean hormone therapy is right for everyone. It means we can finally have nuanced conversations about individual risk and benefit without a regulatory scare tactic dominating the discussion. This connects back to everything we've been talking about today. Medical myths persist partly because correcting them takes forever. The clitoris research that should have happened decades ago. The lice treatments that haven't kept up with evolving resistance. The hormone therapy warning that painted all treatments with the same broad brush. These aren't just academic issues. They affect real women making real decisions about their health. When we don't have accurate information, we can't make informed choices. The encouraging part is that these corrections are happening. Scientists are finally mapping female anatomy with the same precision they have used for male anatomy. Researchers are studying why old treatments don't work and developing new approaches. Regulators are removing outdated warnings that no longer match the science. It shouldn't take 30 years to get equal attention for women's bodies. But at least we're moving in the right direction. What myths about women's health do you think are taking too long to die?
Thanks for listening to Hot Flasher. We're back tomorrow with more, so don't forget to subscribe. See you tomorrow.